Hey, I'm Dr. Charlie Liggett at River Valley Smile Center, and today we want to talk to you about orthodontics. So in our office, we had patients come in all the time. They're always interested in straightening their teeth, and so we'd send them to the proper people. Well, we decided that it would be a really good idea to incorporate an orthodontist in our practice. So I talked with Dr. Roblee some, and he explained to us what they do and what they do in conjunction with Dr. Curry, and it sounded like a perfect fit for what we do.
I want to give a little bit of an introduction about me. I was born and raised here in Arkansas, true and born Arkansan. Grew up in Northwest Arkansas, and after graduating from high school, I ventured on down to the Hill, where I went to college at the University of Arkansas, and ultimately there I met my wife Holly. And fast forward several years, we are now settling back down here in Arkansas. And even though things are kind of crazy right now with the pandemic and life and everything, it's been a lot of fun too, because we've been able to slow down and hang out with their 1-year-old son.
Nice. Well, tell us a little bit about your education.
Yeah, so I went to dental school at Texas A&M College of Dentistry in Dallas. And then after that, I went to UCLA, where I did a residency training program in oral-facial pain. And there we learned about treating things like TMJ, jaw pain, headaches, stuff like that. In addition to starting to look at the airway and seeing how we can manage and look at treating things like mild to moderate sleep apnea. And then after my residency program at UCLA, I went to the University of Pacific up in San Francisco, and that's where I did my training in orthodontics.
Very nice. Yeah, the extra training that you have in airway fits really good with the sleep apnea stuff that we do here in the office.
Yeah, definitely.
So, Dr. Roblee, talking about clear aligners, how often would a patient need to come in for their appointments?
Right, so with clear aligners, actually, we can space out those appointments much further. So instead of seeing the patient every month or so, we can push those appointments out to every 3 or 4 months, with the goal of being that we'd only see the patient 4 or 5 times in total while we're doing treatment.
Oh.
And we know that we're busy parents, everyone's got jobs, kids, activities, and so that's another benefit to using clear aligners or Invisalign, is that we're able to space out those appointments so you don't have to come in as often.
Does having clear aligners change the way you care for your teeth?
Absolutely, and that's another great point. With braces and traditional brackets and wires, it does make things a little bit more difficult as far as keeping the teeth nice and clean. With Invisalign, what the patient does is just simply take out the Invisalign trays, brush their teeth as normal, and floss as well, and that way we're able to maintain the same kind of hygiene that we would in somebody who's not undergoing orthodontic treatment.
Okay.
So do you offer traditional braces, or do you just focus on Invisalign or clear aligners?
So we, for the most part, just focus on Invisalign and clear aligners, and there's some instances where we may use clear aligners in conjunction with braces and wires, but for the most part, we can treat almost any case with Invisalign.
Is Invisalign fairly expensive compared to regular orthodontics or braces?
No, to the patient, it would be the exact same cost as if we were doing traditional braces.
Dr. Roblee, does having clear aligners or orthodontic treatment, does that change the way that somebody looks?
Yes, absolutely. And once you are finished with orthodontic treatment, we expect to see several things. One, you think of orthodontic treatment as just straightening the teeth and making sure they're nice and aligned. But one of the fundamental things that we look at in the new patient evaluation is things like facial profile, straight on aesthetics. And with orthodontic treatment, with clear aligner therapy, we're able to significantly broaden the smile, which can be as important as having straight teeth. Furthermore, we look at lip support, things like that, to make sure that with orthodontic treatment we have the opportunity to influence the soft tissue of the face. And so there's several things that we can do to change that.
That's really good.
Gotcha. So what are the pros and cons of Invisalign or clear aligner therapy versus conventional braces? And then let me give you a second part as well. What are the differences between Invisalign and the mail order aligners that you see on Facebook or Instagram?
Yeah, and the first part of that question, traditional braces versus the clear liners. With clear liners, first and foremost, we want to limit the amount of barriers we have to treatment. And sometimes, especially for adults, that limit is having the braces, having the wires in their mouth. And so when you have clear liners, you're not able to tell that someone's actually undergoing treatment. Okay, so that's a huge benefit.
Really big.
Secondly, which we touched on, was of course oral hygiene. You guys know as dentists and have seen, with braces it is just more difficult to clean and make sure things like plaque and tartar and stuff like that are being cleaned as thoroughly as they should, because it's harder to get into those areas with those appliances. Also with Invisalign, when you're eating, you're able to simply take out the trays, enjoy a meal as you would normally. Okay. And then also, depending on the type of treatment that we're doing, it can also be quicker. Okay, and the reason I say that is one, because it can treat more efficiently, but also with the liners we do all the planing before the patient comes in. Okay, so
now we've all seen on Facebook and Instagram the ads for the direct mail order aligners. What's the difference between a mail order aligner that you'll see on social media and what you do?
Yeah, and that's a great question. We get that a lot often, and the answer to that is we know that when you come into our office, we take a scan of your teeth with the scanner, and we are going to spend a lot of time making sure that we personalize the treatment, cater to the individual in our chair. Okay, and when we are planning the treatment, we are sitting there looking at the x-ray, we're looking at the scan, we're looking at the photos, making sure that we take all of the diagnostic records that we have to come up with that personalized treatment plan for you. Okay. Also, too, we want to ensure the safety of the dental environment for the individual. And by having somebody come in, by having them in the office, we're able to monitor tooth position. We're able to take follow-up x-rays if needed to make sure that the teeth are in a very healthy position to protect the things like the gums and the bone around the teeth. And then lastly, being your motivational coach, your cheerleader, just to make sure that we get you to that perfect smile that we want for you.
Great. So earlier you were talking about how someone can go through less visits, how it's more efficient. Tell us a little bit about that, and what about if someone is from out of town where they can't make it in for visits? So how do you go? How do you maneuver through all that?
Yeah, so of course, again, going back to the busy lives that we all have, we want to make it convenient for the patient to get the orthodontic treatment. And so using something like this, which is dental monitoring, this is a scan box. We give this to the patient at the exam, and it actually can just you can put your smartphone right in here, and the smartphone, turn the camera towards your mouth, and you take pictures at different angles. There's an application, an app on your phone that will walk you through the different types of photos that you need.
Oh wow!
And you can do that once a week, and by doing that, we are watching you every week to make sure that your teeth moves in accordance to the treatment plan that we originally put in place for you. So by doing that, we're able to spread out appointments. If the teeth seem to maybe not be moving as quickly as we thought or would like, then it's as simple as getting you back in for a quick check to make sure everything looks okay.
So you could just use that artificial intelligence to do everything basically after you got your initial workup.
Yeah,
so
exactly.
It doesn't have to come in. Wow.
Exactly, and of course during a time like 2020 with the pandemic, it's especially important to limit the interaction between patient and doctor.
Very nice.
So here at River Valley Smile Center, we see a lot of adults as our patients, and just curious if you can move teeth with braces in an adult like you can in children.
Yeah, that's a great question, and we get that question a lot in our practice. And the short answer to that is yes, absolutely. We've developed some techniques that we're able to get the same results as far as the amount of movement that we can get in adults when we compare that to kids or children.
Well, Dr. Roblee, thanks so much for sharing your knowledge. We're so lucky to have you here. We're glad you're a part of our practice. And if anybody would like to schedule an orthodontic appointment, you can set up a free consult. Just call our office anytime, and we'll get you all set up. Thanks.